many different small changes, some bigger changes, maybe some small interventions, maybe some bigger interventions in order to get out of chronic pain long term. All right, we are coming in hot with another episode of Daily Doc Talk. This is car edition before the gym. So what I want to talk about today is an idea that I talk a lot with patients about. And it's the fact that there is rarely going to be one thing or a small number of things that is going to be what results in you being out of chronic pain for the long term. And there's many different reasons for this. And one of them is the fact that when you have chronic pain, it is not the progression of whether it's tissue changes in the brain. Like there's so many factors that go into chronic pain that it's often such an interwoven, connected concept framework that we're not going to have one thing to untangle all of that. And so usually we are needing to make many different small changes, some bigger changes, maybe some small interventions, maybe some bigger interventions in order to get out of chronic pain long term. Now, some people may be able to do some bigger interventions like an adipose procedure, bone marrow, PRP procedure, whatever it is, and they might see, some short-term benefits from that. But if the other small changes aren't occurring, the things that that are going to address the nutrition, the lifestyle, the supplementation, the mindset, the psychological factors, the social connections, all these things that factor into our brain's perception of pain and therefore chronic pain, then it ends up a lot of the times just being short-lived, and the pain comes back. And so some people, though, can get away with it if the chronic pain is not overly significant, overly severe, hasn't been overly long-standing, but it's still pretty rare that this happens. And so we're always trying to find out, what are the different things that we can implement, and across how many different aspects of life can we implement these things to increase our odds that we are going to see, changes in our chronic pain. And so that's where a lot of the times we're needing to address things from the biological side, whether that's myofascial work, whether that is injection therapy, whether that is osteopathic or chiropractic manipulations. And then we need to address it from the psychological, we need to address it from the social. So there's all these different components that we have to look at addressing, and within each of those components doing even different things, right? So whether it's ice baths and cold plunge, which can help the mental, so the psychological, but also it can help the physical, or nutritional changes, can set up the body to be in a better state of healing, such that when we come in with some of our interventions, we might see a better response. And so there's all these different layers. But what I want you to take away from this video is that try to implement many different approaches. And even if those approaches, even if they only move the needle 2 or 3% on your chronic pain, if you, combine and compilate 10 different things that all those things help 3%, then now you're looking at about a 30% improvement in your chronic pain, which I've talked with a lot of people in chronic pain. And a lot of people in chronic pain would kill for a 30% improvement in their baseline level of chronic pain. And so sometimes it's simple things like nutrition, hydration, sleep, movement and exercise, social connections, breath practice or mindfulness practice. All of these things can add up over time. And so please take a multifaceted approach to your chronic pain, and don't discount the small little individual things, because all of those things, if you do a lot of them over time, will add up. See you later.